Hello everyone, my name is Kailashni. Today I am going to talk about what is dengue. Dengue is a fast emerging pandemic viral disease in many parts of the world. Dengue flourishes in urban poor areas and the countryside in tropical and subtropical countries. Dengue is a mosquito-borne viral infection causing a severe flu-like illness and sometimes causing a potential lethal complication called severe dengue. The incidence of dengue has increased 30-fold over the last 50 years. Up to 50 and 100 million infections are now estimated to occur annually in over 100 endemic countries, putting almost half of the world's population at risk. The full life cycle of dengue fever virus involves the role of mosquito as a transmitter or vector and humans as the main victim of the source of infection. Today it affects Asian and Latin American countries and has become a leading cause of hospitalization and death among children and adults in these regions. The Aedes mosquito is the main vector that transmits the virus that causes dengue. The viruses are passed on to humans through the bites of an infective female Aedes mosquito, which mainly occurs the virus while feeding on the blood. Once infected, humans become the main carriers and the multiplier for the virus, serving as a source of the virus for uninfected mosquitoes. The virus circulates in the blood for infected person for 2 or 7 days at the same time that the person develops a fever. Patients who are already infected with the dengue virus can transmit the infection Aedes mosquito after the first symptoms appear, which is during 5 to 4 days, maximum 12 days. In humans, recovery from infection by one dengue virus provides lifelong immunity against the particular virus serotype. Thank you.
Dengue fever is caused by any one of 4 types of dengue viruses spread by mosquitoes that thrive in and near human lodging. When a mosquito bites a person infected with a dengue virus, the virus enters the mosquito. When the infected mosquito then bites another person, the virus enters that person's bloodstream. After you recover from dengue fever, you have immunity to the type of virus that infects you, but not to the other 3 dengue fever virus types. The risk of developing severe dengue fever, also known as a dengue hemorrhagic fever, actually increases if you are infected a second, third or fourth time. Factors that put you at greater risk of developing dengue fever or a more severe form of the disease include living or traveling in tropical areas. Being in tropical and subtropical areas increase your risk of exposure to the virus that causes dengue fever. Especially high risk areas are Southeast Asia, the Western Pacific Island, Latin America, and the Caribbean. Prior infection with a dengue fever virus. Previous infection with the dengue fever virus increases your risk of having severe symptoms if you are infected again. One dengue fever vaccine, dengue vaccine, is currently approved for use in those ages 9 to 45 who live in area which is high incidence of dengue fever.
Dengue fever is caused by any one of 4 types of dengue virus spread by mosquitoes that thrive in and near human beings. When a mosquito bites a person infected with a dengue fever, the virus enters the mosquito. When the infected mosquito then bites another person, the virus enters the person's bloodstream. After you have recovered from dengue fever, you have immunity to the type of virus that infected you, but not to the other 3 dengue fever virus types. The risk of developing severe dengue fever, also known as dengue hemorrhagic fever, actually increases if you are infected a second, third, or fourth time.